This is NC Spin, an unrehearsed discussion on issues of interest to North Carolinians. Now, here is your moderator, Tom Campbell.
Welcome. You've heard and read the spin the media and the politicians have put on the issues of the day. To get the correct spin on what's going on in North Carolina, we've got a special program for you in this Thanksgiving edition. And we want to introduce former Secretary of Health and Human Services, Lanier Cansler, to talk to us about health care issues. Joining him will be John Hood and Chris Fitzsimon, two of our regular panelists. Welcome, Lanier.
Thank you.
There are several very important and timely issues affecting health care in our state that our new governor and legislature are going to need to address, so let's talk about them. When Governor-elect McCrory met with Governor Perdue recently, they discussed some of these issues. One of them involved North Carolina's participation in health insurance exchange. The Affordable Care Act requires that every state participate in a health insurance exchange, doesn't it, Lanier? Tell us what that means.
Well, what it means, it creates a process by which there are various insurance programs available that individuals can acquire insurance more readily. The exchange is built upon, really on top of Medicaid. Medicaid covers our lowest income individuals. The process is you apply for Medicaid. If you don't get covered by Medicaid, then you can go into the exchange, and the law provides a subsidy to help buy that insurance up to about 400% of poverty.
This is not an optional thing. I mean, the ACA says you will have a health insurance exchange.
It says you will have a health insurance exchange. Now the issue becomes, does the state do it? Does the federal do it? Or you can actually have kind of a partnership between the state and federal in how you put this together. And that's the question that North Carolina is dealing with right now. Do we want to do the exchange? Do we want to just let the federal government do the exchange, or are we going to do it in some kind of partnership?
Well, so where do we stand with this? I know the House took it up and actually passed a resolution on it, did they not?
The House had passed legislation to create an exchange with the concern that if the federal government does it, it's going to be kind of a one-size-fits-all and may not meet the needs of North Carolina. And so they were looking at that. One big issue was governance. Who sits on the board of an exchange? Do the insurance companies have a part of that? And there was a lot of discussion about that. But the House did pass legislation to create the exchange actually in the first session of this last biennium. The Senate has never acted on it for various reasons. And so right now the question is, will the state of North Carolina do the exchange themselves? Will they just say, no, we're not going to do it, as some states have said, or will they somehow partner with the feds and each take some responsibility?
Yeah, my understanding is 8 states have said they will do it, 15 have said that they're not going to participate in that. Is that correct?
There's probably more than 8 that have already got an exchange. Some states had created a type of exchange before the Affordable Care Act was
But in North Carolina, the question is not whether we're going to have one. The question is who's going to govern it. Because one way or the other, the state's going to pay for it.
Under the Affordable Care Act, we will have an exchange. And the federal government has given us some planning money, which the legislature did approve. So we have been doing planning and developing technology, et cetera, to deal with it. But the federal government only has offered so far operational funds for like the first year. And we actually have to make some declaration, some commitment. There's several deadlines. The most important one about money, I think, is in February. We have to make some commitment of what we're going to do to get that money. If we say we're not going to have an exchange, then the feds, that we're not going to do it ourselves, then the feds have basically said, well, we'll do it, but you're going to have to help pay for it. Right now, we don't know exactly how that help pay for it comes together.
Let's get back to the governance issue. I guess that's the thing that sort of jumps out at me. Who are the candidates that potentially, the state's not going to be in the business of governing a health insurance exchange itself, are they?
Well, excuse me, a lot of states have done like a nonprofit organization or created some kind of semi-governmental entity to do this. And what happens is you got to decide, well, who's going to govern it, who's going to kind of set the standards for the policies, who's going to do these kind of things. A lot of advocacy groups did not want the insurance companies like Blue Cross and others on the governance board. The insurance folks said, wait a minute, we're the ones that's really going to make this work. We need to be on the governance board. And that was a big debate, which finally, when it came out of the House, the insurance companies did win some concessions.
You guys keep your ears to the ground pretty closely. What's your take on how this is resonating over on Jones Street with the legislature, and what questions might be raised?
There's a lot of debate about it. I mean, there are some people in the legislature and probably in the incoming administration who are sympathetic to the argument that the state by having its own exchange, will have some sort of control or flexibility. Others, and I'm more sympathetic to this argument, see that very little difference. I mean, the federal government is going to determine everything that happens pretty much. And there's also the wrinkle that if the federal government sets up the exchange, under the way the law is written right now, there's some very unclear authorization for much of the rest of the bill, like the tax credits may not even be required under a federal exchange. It is such a poorly written piece of legislation. I think actually many states will say, not right now. If you want to go set up an exchange, go ahead. We'll look at it later, and that's what Virginia has said. I think that's what North Carolina will say.
That's what Governor McCrory alluded to this at his first press conference, is that there were more questions to be asked than answers available.
Well, and that's why there's a 90-day extension to, I think it's February 15th for a lot of the details, but I obviously have a different view. It doesn't make sense to me if we complain about the federal government setting all these rules and regulations. There is some flexibility on some things. There's some things that we should debate, the makeup of the exchange, the benefit packages. There is a little bit more flexibility, I think, that we've been led to believe about what those are. I mean, what these really are is it's an online marketplace for people to choose their insurance policy and what they and which one they're going to have. And I think it's important that North Carolina does it. I think the General Assembly ought to come to their senses and approve one.
Lanier, we had a deadline earlier this month, before Thanksgiving, as a matter of fact, in which the state had to declare. So we declare that we're going to set up our own health care exchange. Now, what happens if the governor, incoming governor, and new legislature decides they're not going to do this?
I think the declaration just keeps the option open.
So this is kind of a placeholder.
I think it still keeps the option open. I think if the legislature says we're not going to do it, I don't think there's any penalties or anything for failure. But it keeps the option open that says, you know, we're going to create the exchange, full well knowing that the legislature has to act to really make it happen.
All right, topic 2 is Medicaid expansion, and we'll get to that in a minute. You can enjoy NC Spin all during the week. Visit ncspin.com and read the new section on political perspectives that we're posting. Also, video stream any shows you miss from our website. And NC Spin on Facebook is almost an hourly forum on news and views from panelists and readers across the state. So stay in touch with public policy issues on ncspin.com and NC Spin on Facebook.